Hello friends, welcome to the channel Dewdear Academy. Today I am discussing the question paper that is SCT Trivandrum, Sree Chitra Institute for Medical Sciences and Technology, Trivandrum. The staff nurse examination question paper. The examination was conducted in 2016 for the post of staff nurse on temporary basis. And this is the part 1 of the question paper discussion. An academy is one of the India's largest educational platform and it has now gone global. And an academy is providing a lot of online courses and there is great opportunity for nurses now because they have come up with NCLEX-RN preparation course and they are providing 100 plus practice questions and 7 test series. All the content are provided free. So this is a very good opportunity for all nurses who are preparing these NCLEX-RN courses. And you can access the Unacademy through the link that will be given in the description. And this will be a very useful and effective platform in upgrading your knowledge. These NCLEX questions will be useful for all other competitive examinations. All the content are provided free so that you can practice the questions and also you can attempt this mock test. So don't miss this opportunity. This is a very useful and effective platform in upgrading your knowledge. Also, you can access Unacademy through the link. It will be given in description. So please follow the link. So let me start the question discussion. So this is a written test on 2011-2016 temporary staff nurse post. And the first question is, a condition in which a single vessel overrides both ventricles is called transposition of great arteries, hypoplastic single ventricle tetralogy of Fallot, truncus arteriosus. The question is the condition in which a single vessel overrides both ventricles. So here we should know what is transposition of great arteries. Transposition of great arteries means it is a birth defect in which the two main arteries of the heart, that is pulmonary artery and aorta, these will be in a switched in position. So that is transposition of great arteries. Here the two main arteries, that is pulmonary artery and aorta, they will be found as in a switched in position. That is transposition of great arteries. It will be found in a switched in position. So what happens is aorta, which carries the oxygenated blood, will be carrying deoxygenated blood. So it is a very fatal congenital malformation. Then next is option B is hypoplastic single ventricle. Hypoplastic single ventricle. That means there will be only single pumping chamber or ventricle instead of two. And also hypoplastic means it will be too small or underdeveloped. That is hypoplastic, too small and underdeveloped. Then tetralogy of Fallot. Tetralogy of Fallot means it is a combination of 4 heart defects. There will be 4 heart defects in tetralogy of Fallot, and that include pulmonary stenosis, right ventricular hypertrophy, then overriding aorta and VSD. These are the 4 heart defects which is found in tetralogy of Fallot: pulmonary stenosis, right ventricular hypertrophy, overriding of aorta and ventricular septal defect. And the last option given is truncus arteriosus. What is truncus arteriosus? Here this is a rare type of heart disease in which a single blood vessel comes out of right and left ventricles instead of normal 2 vessels. Instead of normal 2 vessels, that is pulmonary artery and aorta, there will be a single blood vessel which is coming out of right and left ventricle. Single vessel comes out of right and left ventricle. So here in our question, what is the condition in which a single vessel overrides both ventricles? So from this, the answer is option D, that is truncus arteriosus. Option D is the correct answer. Then question number 2. Which form of communication is said to be the heart of nursing practice? Question is, which form of communication is said to be the heart of nursing practice? Options are intrapersonal communication, therapeutic communication, interpersonal communication, public communication. So which communication is considered as the heart of nursing practice? So first we will think about intrapersonal communication. Intrapersonal communication means it is intra. Intra means it stays within a person. stays within a person. This type of communication stays within a person. That is, it is coming from inside, like a self-talk. That is intrapersonal communication, self-talk. Then option B is therapeutic communication. That is, it is a patient-centered communication. Therapeutic communication is a patient-centered communication and it is focused on the patient. That means the goal is to promote a greater understanding of patient's needs, concerns and feelings. So we will call it as a patient-centered communication is known as therapeutic communication. The next is interpersonal communication. This is one of the foundation of quality patient care. Interpersonal communication is one of the foundation of quality patient care. That means one-to-one interaction between nurse and another person. Interpersonal means a one-to-one interaction. There will be a one-to-one or face-to-face interaction between nurse and another person, and this is the level that is most frequently used in nursing situations. It is most frequently used in nursing situations, and thus it is considered as the heart of nursing practice. It lies at the heart of nursing practice. So this type of communication, interpersonal communication, is one-to-one interaction between nurse and any other person, which is provided face-to-face interaction, and it is the most frequently used in nursing situations, and it lies at the heart of nursing practice. And the last one is public communication. Public communication means it happens when a person or a group of people gather and start sharing information to an audience. When a communication is given or it is shared to an audience, information is shared to an audience, that is public communication. So these are the different types of communication, the options which is given. So in our question, which form of communication is said to be heart of nursing practice? Now it is clear, option C is the correct answer. Interpersonal communication is considered as the heart of nursing practice. Then question number 3, audit cycle include all except. Options are set standards, observe practices, audit committee, compare with standard. So please read the question once more. Audit cycle include all except. So the main key term is except. So the options include setting standard, observing the practices, then audit committee, comparing with the standard. So from this we should know the steps of audit cycle. The steps of audit cycle include, the first one is identify the audit topic. First one is identify the audit topic, identifying the topic. And second one is set desired standards, set desired standards. And the third one is collecting the data, collect data. Then compare the data with the standard, compare the data with desired standard, compare the data with standard. And then last is implement changes, implement changes. And then again it is continuing, the cycle is continuing with identifying the topic. So this is audit cycle. So from this we know setting standard, and then collecting data or observing the practices, and then comparing this data with the standard. All these are option A, option B and option D. All these are coming in the category or coming in the cycle of audit, that is audit cycle. But audit committee, it is not a part of audit cycle. It is not a step in audit cycle. Even though audit committee is formed before carrying out an audit, and it will be comprising of people who are interested in quality assurance and who will be clinically competent and who are able to work together in a group. So audit committee will be formed, but it is not a part of audit cycle, the steps of audit cycle. So correct answer is option C. Answer is option C. Then fourth question, MRSA nasal carriers should be treated with. Options are povidone iodine, 1% mupirocin, then 10% mupirocin and vancomycin. MRSA nasal carriers. MRSA means methicillin resistant Staphylococcus aureus. So MRSA nasal carriers should be treated with. So here we should know that mupirocin or Bactroban is an effective in removing Staphylococcus aureus from nose over a few weeks. So mupirocin is it is effective in removing this Staph aureus from nose, and it can be given, or it can be given as a topical antibiotic ointment. It is applied in inner part of the nose to reduce the amount of MRSA, and it is used for infections that cannot be treated with other antibiotics. Mainly it is used for infections that cannot be treated with other antibiotics, and it is usually, the dose is 1% mupirocin. 1% mupirocin is usually effective for treating this MRSA nasal carriers. So option B is the correct answer here. Option B, 1% mupirocin. Then question number 5, intra-aortic balloon pump therapy is used for treatment of. Options are congestive heart failure, pulmonary edema, cardiogenic shock, aortic insufficiency. Intra-aortic balloon pump therapy is used for the treatment of IABP. It is a simplest and cost-effective device that increases the myocardial oxygen perfusion through the dilation of coronary arteries during diastole, and thus it augments the cardiac output. It will be increasing the cardiac output, and it is effective for initial stabilization of patients with cardiogenic shock. It is effective in stabilizing initial stabilization of patients with cardiogenic shock. Actually, it is contraindicated in patients with aortic regurgitation. So here option C is the correct answer. IABP is used for treatment of cardiogenic shock, and it is contraindicated in patients with aortic regurgitation. And also we should know that it is most useful to stabilize the patients with a surgically correctable lesions which is causing the heart failure. In case of those cases, if there is any surgically correctable problems or lesions are there which is causing heart failure, in that case IABP is effective. And so we can say the most appropriate answer here is for the stabilization of patients with cardiogenic shock, and also it is contraindicated in patients with aortic regurgitation. Then question number 6, which of the following ECG findings indicate the presence of hypokalemia? Options are tall peak T wave, widening of QRS complex, prolonged PR interval, and ST segment depression. So which ECG finding is indicating the presence of hypokalemia? The question is hypokalemia. So what are the main ECG findings in hypokalemia? We know that hypokalemia will be resulting in slowed conduction, and so ECG changes include flattening or inversion of T waves. So there will be inversion of T waves, then that will be mainly found in mild hypokalemia, then followed by QT interval prolongation, and visible U wave. Visible or prominent U wave is there. That is a very important sign in hypokalemia, ECG change in hypokalemia, that is visible U wave, and also mild ST depression in more severe hypokalemia. There will be mild ST depression. Mild ST depression can be found in case of severe hypokalemia. So these are the main ECG findings or ECG changes which is found in case of hypokalemia. In hypokalemia, conduction will be slow and there will be flattening or inversion of the T waves, then QT interval prolongation and visible U wave, and there will be visible U wave and mild ST depression in case of severe hypokalemia. So from this options, tall peak T wave is not there, prolonged PR interval is not correct, then widening of QRS complex is not correct, but option D, ST segment depression is a finding, ECG finding in hypokalemia. Then question number 7, before radial arterial cannulation, evaluate radial or ulnar arterial patency by. Options are Allen's test, angiography, Valsalva maneuver, capillary refilling test. The question is, before radial arterial cannulation, evaluate the radial or ulnar arterial patency by. So the correct answer is option A, that is by Allen's test. What is Allen's test? It is used to assess the collateral blood flow to the hands. Generally, it is in preparation for a procedure that is going to disrupt blood flow in the radial or ulnar arteries. Before the procedures that is going to disrupt the blood flow in all these arteries, we are doing the Allen's test in order to assess the collateral blood flow to the hands. And procedures like arterial puncture or cannulation. Before these procedures, Allen's test is done. Positive Allen's test means the patient does not have adequate blood supply to the hand. So it will be considered as a contraindication to the planned procedure. If Allen's test is positive, means that is indicating inadequate blood supply to the hand. So that procedure will be contraindicated. It may present as a contraindication to the procedure. The procedure cannot be done. Then so that is Allen's test. Then next is angiography is another option given here. Angiography is an imaging technique. It is used to visualize the lumen of blood vessels. Then Valsalva maneuver is, that means for exhaling forcefully against a closed airway by pinching the nose and mouth closed. Valsalva maneuver means it is the forced expiration against a closed airway. That is Valsalva maneuver. It is used for increasing the tone of vagus nerve. It is used for increasing the tone of vagus nerve. That is Valsalva maneuver. Then capillary refilling test is a rapid test which is used for assessing blood flow through the peripheral tissues. Capillary refilling test is a quick test which is done on nail beds and all. It is for assessing the blood flow through the peripheral tissues. So from all these options, before radial arterial cannulation, evaluate the radial or ulnar arterial patency by Allen's test. Then question number 8, paradoxical elevation of jugular venous pressure during inspiration and which occurs in patients with chronic constrictive pericarditis and tricuspid stenosis is. Paradoxical elevation of jugular venous pressure during inspiration and which is occurring in patients with chronic constrictive pericarditis and tricuspid stenosis is. Options are Kussmaul sign, Kernig sign, Hamann sign, Brudzinski sign. Kussmaul sign, Kernig sign, Hamann sign and Brudzinski sign. So here correct answer is Kussmaul sign. Kussmaul sign is the correct answer. It means the paradoxical increase in JVP, jugular venous pressure, that occurs during inspiration. That means JVP normally, JVP will be decreasing during inspiration. Normally, in case of normal situation, jugular venous pressure decrease during inspiration. But here, in case of chronic constrictive pericarditis and tricuspid stenosis and all, there will be paradoxical increase in JVP during inspiration. Instead of normal way of decreasing, what happens here is JVP increase during inspiration. JVP will be increasing during inspiration. So this paradoxical increase or elevation of JVP during inspiration, which is found in chronic constrictive pericarditis, is Kussmaul sign. This is a classical sign in pericardial tamponade and constrictive pericarditis. So correct answer is option A. Then other options like Kernig sign, it is found in meningitis. Kernig sign is found in meningitis. Then Hamann sign. Hamann sign, it is a dorsiflexion test which is used to test DVT. So Hamann sign, it is a dorsiflexion test. Hamann sign is also known as dorsiflexion test, and it is used to test DVT, that is deep vein thrombosis. Then Brudzinski sign. The next is the Brudzinski sign. It is a sign in meningitis. This is also a sign in meningitis. So here correct answer is option A, Kussmaul sign. Thank you.